have here.
Hello, and thank you for joining our District Wellness Public Forum. I'm Kelly Simpson, the District Health Coordinator for the Woodford County Public Schools. Here with me are Courtney Quire, the Food Service Director, and Amy Oates, the MTSS Coordinator and School Psychologist. I will begin by presenting my information, then Courtney and Amy will follow. To begin, I wanted to provide you, our school families, and community members with the steps we have taken as a district to keep our buildings as healthy and safe as possible for all of our students and staff.
There we go.
Okay, to begin, this is a picture of our school nurses and the health department staff. We are very grateful for all of their assistance they've given us this year. In March, we began attending local emergency planning meetings hosted by the Emergency Management Director in Woodford County and the Public Health Director. From there forward, our partnership and collaboration with Cassie Prather, the Public Health Director in Woodford County, and her staff has been invaluable. We have continued to communicate daily with Cassie and her staff. When schools closed in March and NTI began, our focus immediately shifted to planning for the most safe and efficient way we could provide meals to students. With the guidance from the health department, we created a health screening tool which included taking staff members' temperatures and asking health-related questions to anyone that was assisting with food prep or handing out NTI packets and Chromebooks. The health department provided us with masks, hand sanitizer, and disinfectant to assist with these processes. The health department also provided guidance on how to safely complete graduation. They assisted us with putting protocols in place for CPR and summer medication training classes to coaches and staff, as well as meet and greets. They also have and continue to review and provide feedback on all sports return to play and practice plans and kindergarten screenings. Over the summer, Mr. Hawkins, Mrs. Prather, and I walked every classroom in the district to assess for the best way of social distancing and the potential need for moving or rearranging furniture. There. The picture of the document you see on your screen was written with input from the Governor's Office, the Department for Public Health, and the Kentucky Department of Education, as well as a few other entities. It contains best practices and safety expectations and has been extremely helpful to us with creating and implementing health and safety processes and protocols. In consultation with our board attorney and the public health director, a decision tree was created. This is the slide of the decision tree. We also created processes and procedures for when we return to in-person school, such as taking students and staff temperatures upon arrival to school, at the car rider line or upon entering the bus, and again at lunchtime. Frequent encouragement of hand washing, desk cleaning at class change, and hand sanitizer in all classrooms. All of our students and staff are required to wear masks at all times except when actively eating and drinking. Mask breaks are provided outside and students are socially distanced. Masks are provided to students if they don't have one. Social distancing has been implemented in all hallways and classrooms. Hallways are one way only. Plexiglass has been placed on all cafeteria tables in the middle school and high school. Students are socially distanced in the elementary school cafeterias. All custodians have been moved to day shift as much as possible to assist with more aggressive cleaning during the day, and a cleaning company was hired to spray high-touch surfaces on the evenings. We are in-person school. This is just a list of PPE that we have ordered to begin our school year. Our district purchased fabric, thread, and elastic, and the inmates at the Woodford County Jail were very excited to help us by assisting in making masks for students and staff at no charge. We purchased face shields, goggles, shoe covers, hair covers, disposable masks, medical grade gloves, and non-medical grade gloves, and KN95 masks were provided by the health department. Plexiglass was purchased for school offices, isolation rooms, and the middle school and high school cafeterias. Air purifiers were purchased for isolation rooms. A large amount of hand sanitizer was donated. No-touch forehead thermometers were purchased for buses and schools for morning temperature checks. Gloves were provided to teachers. Standing thermometer devices were purchased for all schools to assist with time efficiency. Water bottle filling stations were purchased to replace water fountains. And no-touch paper towel dispensers were purchased to replace hand air dryers. You can see the first picture there. That is actually a clear plexiglass door, and that's just so we can monitor students more effectively and have them in eyesight at all times. As far as quarantines and positive reporting, the health department assigned a Healthy at School liaison to be our main point of contact. We have a shared spreadsheet which assists the nurses in obtaining up-to-date information in live time. School nurses assist with providing classroom charts, or seating charts, and bus seating charts are also given to the health department, and other pertinent information to the disease investigators. An advisory letter is sent out per the guidance of the health department to classrooms, buses, and sports teams if someone tests positive. Students and staff diagnosed with COVID-19 or placed in quarantine are reported daily on the Kentucky COVID Dashboard website and also on the WCPS website on days we are in school. On December 9th, a Q&A vaccine informational video was sent to all district staff. The public health director and I recorded it. We received a lot of positive feedback. We actually received feedback from some who said that we really changed their mind on receiving the vaccine, and we're very thankful. We have had vaccine clinics on January 20th and January 27th for our teachers and staff, and these were very, very exciting days. Thank you very much for tuning in today.
Hello everyone, I'm Courtney Quire and I was hired as the district chef in 2014. 2 years later I became the food service director. I'll be giving an update on our department today. We participate in 3 nonprofit federally assisted meal programs. The National School Lunch Program, the School Breakfast Program, and the Summer Food Service Program. The goal of these programs is to provide nutritionally balanced, low-cost, or free meals to children. During a normal school year, we utilize the SBP and NSLP. Students receiving these meals are given a status of free, reduced, or paid. During the summer months, we use the Summer Food Service Program. In SFSP, all kids 18 and under qualify for free meals. In response to the pandemic, the USDA allowed schools to use SFSP for the 2021 school year, making all meals free for all kids. We were also granted multiple flexibilities to ensure all kids had access to our meals. The most beneficial waivers for us have been the ability to serve meals outside of a traditional time frame, and allowing for non-congregate meal services. We've also been able to permit parent pickups and deliveries, and most of all, allowing SFSP operations for the school year. For our virtual students, we provide curbside meal pickups at all schools on Tuesdays from 10 to 1. We also do home deliveries for those unable to pick meals up. For our in-person meal service, we now do temperature checks, hand sanitizing, no self-service, and additional meal periods to allow for distancing. At middle school and high school, we have installed the plexiglass dividers on the tables, and students are also assigned seating to make contact tracing possible. This next chart is our average daily participation comparison between a normal school year and this school year. During a normal school year, we serve on average 2,500 lunches and 1,500 breakfasts per day. Our participation now varies greatly depending on what is going on with COVID that week. We serve around 1,200 lunches and 1,000 breakfasts. Next, I'd like to show you our webpage and our online menus.
Sorry, hit that again. All right, thank you, Courtney. I am Amy Oates. I am the MTSS coordinator for the district, which stands for Multi-Tiered System of Supports. And so a lot of what I do is help look at the academic and behavioral pieces within our district, supports that we have, data that we have for those supports. One thing that falls under my job is also to look at what social emotional pieces we have in our school buildings. And so making sure that we have support for mental health within our buildings, making sure that we are utilizing community support within our buildings as well. So I am new to working in Woodford County in this position. I started at the end of August, and I'm very happy and excited with all of the initiatives that Woodford County has in regards to mental health and mental wellness. We have a lot of new and continued initiatives that we have had going on this school year, even though we have spent most of the year virtually. These things have continued during that virtual learning time. So one thing we have is a partnership with the Kentucky Academic and Behavioral Response to Intervention, or Kentucky ABRE Group, and they are based out of the University of Louisville. And that partnership has been going on for several years, and they provide us a lot of coaching and consultation and support, as well as training for mental health and how to incorporate mental wellness within our schools. Starting at least since we've been out in March, many of our schools have been doing virtual check-ins with their students. And I know that at least since January, all of our buildings have been completing some kind of mental wellness check-in on a daily or weekly basis. For most of our buildings, that looks like a Google check-in. You may have seen your students completing. And that just gives some feedback about if we need to offer additional support for our students based on their emotional level. I'm also happy to report that a couple of our buildings have also been doing that type of form for their staff members to make sure that they're checking in on their staff and making sure that their staff have any kind of support that they need. We have also continued with our social emotional learning initiatives throughout this time. And so for kindergarten through 8th grade, we utilize a program called Second Steps. And that's taught in a weekly format typically. And then teachers try to also embed lessons throughout the week with whatever topic they are covering at that time. For our high school, we have a yoga partnership with Homegrown Yoga here in town. And in addition to certifying some high school students as yoga instructors, we have also been conducting on Wednesdays in January a live stream yoga class that has been led either by current students of Woodford County High School or former students of Woodford County High School. And we have posted those videos. If students were unable to attend them live, we have them up on our district wellness website, which I'll talk about in a little bit. We also this year had a mental health screening opportunity with one of our community partners, New Vista, and that went home to through email to all elementary students, and that was a health screening form that they could complete, and then New Vista could get back in contact with them about doing a screening for possibility of a more intense services. And we hope that this spring that we will have that opportunity with them to look at our middle and high school students as well. Now I want to give you a little tour of our district wellness website that we have created. The idea behind this was just to kind of have a one-stop shop for both physical and mental wellness supports within our community. You can get to it by going to the district website and clicking on the icon. And I have a video explaining more. Wellness resource. We'll put that over there. All right, this concludes our presentation for our wellness forum today. I see that we do have some individuals watching. I'm not sure if there are any questions or comments. Looks like nobody's put anything in the chat box yet, so we can hang on for a couple of moments to see if you all have any additional questions for us. All right, since there are no questions and comments, this concludes our forum for today. Thank you for tuning in and watching.
Thank you.